Hi, I am Dr. Hirennappa, pulmonologist practicing at Inspire Specialty Clinic at Sakarnagar. Smoking is the biggest risk factor for a lot of other diseases. It's a risk factor for COPD, it's a risk factor for lung cancer, it's a risk factor of various other cancers and heart diseases. It's the biggest risk factors, and it's a reversible risk factor. Means if you stop smoking, you can prevent a lot of things. And one of the way to screen in a smokers objectively, some people are willing to quit. It's addict forming, and it's a high amount of nicotine dependence. So what happens in smokers? How do you screen? So once the patient comes to us, we ask the smoking history, how much, whether they smoke beedi, whether they smoke cigarettes, and how many pack years they have every day, how much smoke. If the first day in the morning there's an urge to smoke, and whenever they try to quit smoking, they get any withdrawal symptoms like sweating, urge to smoke again, and because of the peer pressures they end up smoking again. These are the symptoms. We look at it, and once they are seen, the first thing is just do a simple screening X-ray and see if there are any changes of COPD. Normally the X-ray will be normal. Sometimes there will be prominent bronchovascular markings, what we call as a dirty lung picture. So that might be a manifestation. So the patients can be seen suddenly in an emergency with acute exacerbation as a first episode of COPD, where they come with a pneumonia or this kind. But normally these are during exacerbation. Normally in a routine screening, these are the manifestation: bronchial wall thickening, vascular markings are prominent. These are the changes we see in X-ray. Very rarely, if there is a high index, you can find a small nodule in the lung, which can be a first sign of a cancer, which requires further evaluation. So other thing tool, because in the lung will not be much changes since it affects the airway, pulmonary function test or a spirometry, which is called, or a peak flow meters, normally used in asthma, and because since it measures in a first second, and even the COPD is of small airway diseases, we need to do a full spirometry or a lung function test it's called, or a pulmonary function test it's called. There we see the following changes. Normal spirometry will rule out COPD, whereas unlike asthma. So what happens in the changes? The first changes means if you see a flow volume loop, there may be a cooing of expiratory limb, or there might be a small airway obstruction. Sometimes there will be a large airway obstruction, and if you do a reversibility testing, there will be a partial reversibility that confirms it is COPD.